Hi, I'm Uma, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello everyone. Low back pain is a common complaint by many patients. Almost every adult now is complaining of low back pain. One of the most common causes of low back pain is slipped or herniated disc. You might think of the spinal column as a solid unit that is also flexible to allow movement in different directions, while in fact, it consists of small moving parts that work together. Our spinal column is made up of a series of bones called the vertebrae stacked onto each other. Each segment of our trunk has a specific number of vertebrae. The spinal column includes 7 bones in the neck segments or cervical spine, 12 bones in the thoracic spine or the chest area, 5 in the lumbar spine, followed by the sacrum and coccyx at the base of the spinal column. The vertebrae are cushioned by flat, round, cartilaginous pads called the intervertebral discs. Both the discs and the vertebrae create a canal where the spinal cords run inside it and the spinal nerves emerge from it. These electrical cables run inside the canal, carrying messages from our brain to our muscles and other parts of our body. Our role today is to answer most of your questions regarding intervertebral hernia. Today, we have Dr. Kim, who is a leading doctor at Jaseng Hospital of Korean Medicine in Seoul. He's going to discuss with us everything about intervertebral hernia from an experienced medical point of view. So intervertebral hernia, what is it?
Commonly referred to as a disc, the disc is not a disease name, but a spinal anatomy. There is a substance between the bones of the spine that can relieve the impact of the bones. This substance is called a disc. And the case where the discs are gradually pushed out by impact is called a disc herniation.
What are the symptoms for this disc?
This is the disc you see here. The disc that pops out by pressure is called a slipped disc, and there is a nerve behind the disc. When these discs press on the nerves, it hurts the back, hips, and legs, which are the pathways through which the nerves pass. Because it's a nerve problem, numbness in the leg, aching, or pulling pains are typically symptoms of a slipped disc.
Okay. So what are usually the different types of hernia?
Discs can be roughly divided into 4 types. At first, the pressure starts, also called bulging, so the first stage is where the disc is swollen. The second is called protrusion, and the protruding disc is called a second stage disc. When the pressure becomes more intense, it is called extrusion, and the state where the disc has penetrated through the ligaments is expressed in the third stage. The fourth is when the popped discs flow downward, and this is called sequestration. So the disc is classified into a total of 4 types.
So how do you diagnose if it's an herniated disc or not?
Firstly, when doctors see patients, they do a test. They put the patient on their stomach and try to raise their leg or see how much strength they have in their ankles, and see if there is a difference in sensation, and determine if there is a nerve problem or a muscle problem. To be more accurate, we can actually take X-rays, CT, and MRI, but MRI is the most accurate way to diagnose a herniated disc.
So in the case of a patient with herniated disc, what are the treatments available?
In the case of disc patients, as we're in Korea, there are things that can be treated with both Western medicine and Korean medicine. With Western medication, things that can be easily used are painkillers, injected therapy, or physical therapy and exercise therapy. In Korean medicine, there's something called Chuna therapy. Acupuncture, herbal acupuncture, and herbal therapy are also used to approach disc treatment.
So who is more at risk of disc?
Back in the day, people who actively used their spine and the elderly were at risk of spinal diseases. But these days, it is not. Nowadays, anyone in their 20s to 60s can have a spinal pain because modern people sit for a long time and use computers. Their postures are damaged and the muscles are weakened. So anyone can easily develop spinal diseases.
Anyone, okay. So how do you differentiate between a disease of the spine and other diseases?
It's a difficult question, but since it's a spinal problem, of course it may be that it hurts when the spine moves or when the joints move. But conversely, it may be caused by tension in these muscles around the spine, rather than the spine itself. Or the same symptoms may also occur due to problems with blood vessels. Therefore, it can be said that this requires things that doctors can diagnose by themselves.
So how effective is the Korean medicine in treating hernia?
Of course, as I am a Korean medicine doctor, I would recommend Korean medicine. But for disc treatment, because discs can be treated without surgery, Korean medicine opposes surgery. The advantage of Korean medicine is that it does not focus on the disc that's simply causing the pain, but rather than treatment that changes the environment and structure in which the disc is occurring. For example, there are people who have a disc pain due to a twisted pelvis. For these people, we use tuna therapy, which corrects the distortion of the spine by correcting the legs and pelvis. Then spasticity, stiffness, and tension in the muscles that may be caused by these discs or inflammations are released through the acupuncture in herbal acupuncture. More importantly, there is a herbal medicine made with natural drugs that can heal the disc for inflammation and wounds on the protruding area. When this herbal medicine enters, the wounds on the discs are reduced one by one, and the disc phenomenon gradually subsides, and the spine can be strengthened in a healthier shape than before. That's why I'm saying that Korean medicine treatment is a fundamental treatment and a good way to strengthen it.
Okay, very nice. So you said that anybody can suffer from this disease, anyone. So how do average people prevent this disease?
There are two things I'm emphasizing. One is posture and the other is exercise. Yes, those who come to the hospital, strangely, all have bad posture. It's because it hurts because the posture is bad. When they come, they all sit like this. The back is curved and the neck is out. This is how they live. They walk like this as well. Because of this, it hurts the neck and lower back more and more. The first thing is to make sure your posture is right. Modern people usually sit before they don't have time to walk, so their muscles weaken. It's all because of these things. So if you do these 2 points well, you can protect and strengthen your spine much more.
Yeah. So what kind of sports do you advise people to do? Is it like weight training or like sports that helps strength of the body?
These days, the trend is yoga, Pilates, and everyone does PT a lot. It is really good exercise. But patients with spinal problems shouldn't start this kind of exercise right away. Spinal patients already have tight muscles, so they need to release these muscles before strengthening them. But the best thing to relax your muscles is walking. However, people don't walk often and don't walk in the correct posture. In just 30 minutes of walking correctly with your chin pulled in, you can keep your spine strong and well maintained.
If somebody have a sudden attack of a hernia disc, then what kind of first aid we can provide to that person?
In case of acute pain, of course it is good to go to the hospital. But if it is too painful to move, the first thing is to rest until the pain subsides. So, lying down is the most comfortable and less painful position in bed. The important thing is that if you put an ice pack on the sore area, the inflammation and pain subsides in about 2 to 3 days. Then it is better to visit the hospital afterwards for diagnosis and treatment.
So we talked before about Korean medicine as a solution for herniated disc. Are there any surgical interventions that are done in the case of herniated disc?
In our experience, when we look at spinal patients, about 1 in 10 people need surgery. It's not that all patients can't have surgery, but there are always patients that need it. The test may consider surgical methods if the patient's muscle strength, leg, and arm strength is too low. They can't sleep at night or the pain is out of control. So 1 in 10 people need surgery, and you can see the symptoms that require surgery. The most important thing is that there are symptoms of failed muscle strength in the legs, weakness in the arms and legs. Secondly, if you have been treated for 3 months but you can't stand the pain, in that case, you can do surgery. The most important thing is cauda equina syndrome, which is a dangerous symptom. What this means is that the disc is too big and puts hard pressure on the nerves. It can cause problems with the stool and urine. Some people say they do not know when the sphincter is loosened, and the stool leaks without them knowing. Or they want to urinate, but it doesn't come out. These people are those who need emergency surgery quickly. But if that's not the case, then it's not a good idea to have surgery just from symptoms such as pain.
Thank you, doctor, for your time. Intervertebral hernias are commonly referred to as disc. However, this disc is not the disease name, but a spinal anatomy. There's a substance between the bones of the spine that can relieve the impact of bones. This substance is called a disc, and when discs are gradually pushed out by impact, it's called a disc herniation. The disc that pops out by pressure is called a slip disc, and there is a nerve behind this disc. When these discs press on the nerves, it hurts the back, hips, and legs, which are the pathway through which the nerves pass. Because it's a nerve problem, numbness in the leg, aching, or pulling pains are typically symptoms of slipped disc. Discs can be roughly divided into 4 types. At first, the pressure or bulging starts, so the first stage is where the disc is swollen. The second type is called protrusion, and the protruding disc is called a second stage disc. When the pressure becomes more intense, it is called extrusion, and the state where the disc has penetrated through the ligament is expressed in the third stage. The fourth type is when the popped disc flows downward, and this is called sequestration. Diagnosis is done initially by placing the patient on their stomach and try to raise their legs or see how much strength they have in their ankles to see if there's a difference in sensation and to determine if this is a nerve problem or a muscle problem. It is then supplemented by X-ray, CT, and MRI for more accurate analysis. Thank you for joining us again today at CloudHospital TV. If you have any questions or comments, please leave them below and respond to you as soon as possible.